Alright, we also have an issue with legality. In San Francisco, they enacted a similar ban that prevented the sale of tobacco in pharmacies. Now, this just applied to the didn't apply to the grocery stores that had pharmacies in them. These are just the pharmacies themselves. And Walgreens and Philip Morris USA both enacted lawsuits to try and prevent this ban from coming into effect. And this specifically has something to do with the Boston ban, because Philip Morris USA was concerned with federal constitutional law. That was what their complaint was. So if they were to win their lawsuit, it would apply to Boston as well. Both cases have had their first round in court, and the smoking ban was upheld both times. But both companies plan to appeal, so there's still a chance that our regulations will get thrown out. Alternatives. Just three pretty basic alternatives. At least the first two are pretty basic. The first, continue the existing program. Eliminate the new regulations, or alter program along what I call voluntary lines, and I'll go into what that means in a second. Alright. The voluntary lines are geared towards protecting the rights of voluntary smokers and protect the rights of involuntary smokers to not inhale particles that are going to negatively impact their health. And some of these new regulations fall on both sides of that. Voluntary smokers I classify as people who smoke or people who choose to work in an establishment that is specifically geared towards smoking. And involuntary smokers I call people whose workplaces are not specifically geared towards smokers. Alright, so in order to alter it along these voluntary lines, we would need to get rid of the specific policies that restrict the sale of tobacco products in educational institutions, healthcare institutions, and grocery stores which contain pharmacies. The people who are buying those products are obviously voluntarily using them, and there's, as I mentioned, an argument for the indirect educational impact. If children see these products being sold in educational institutions or health institutions, they get the message that it's okay. But that's kind of a weird, indirect way to educate children, and it's just not a good enough reason to take away someone's rights to have a convenient pack of cigarettes. We need to resume issuing permits for smoking bars. I think it's pretty clear that, and don't require those smoking bars to close. I think it's pretty clear that everyone involved in smoking bars is there because they're okay with smoke. Some of these regulations we'll want to keep, though. We'll want to continue banning smoking in hotels and other lodging establishments. As I said, the smoke can stay in the room for someone to come in and clean the room, and they'll inhale that, or it can get through the ventilation into other areas of the hotel. and get into the lungs of people who are non-smokers. We also need to continue banning smoking in outdoor places that are adjacent to indoor workspaces. As I said, we don't have the data to really indicate that a high enough concentration of these particles are getting into the indoor workspaces to cause problems, but maybe the burden of proof is to show that they don't cause problems. I mean, clearly some of the particulates are getting in, and to be safe, we should keep that particular regulation. And we may as well continue requiring signs about the danger of smoking in smoking bars. Clearly, everyone who goes into there ought to know about the health risks. You could say that they already know, but it's not really going to hurt much, so we may as well keep that regulation in. And that's the end of my little presentation. Hope you enjoyed it, and I hope I get a good grade.